Hi, everybody. I'm Dr. Qazi. I'm a skin restoration specialist in Newport Beach, California. I want to go over this particular case. I focus mostly on acne, on scars, and pigmentation. I have an excellent patient right over here who had done his scar treatment about a year ago, and this was after a single session for him. So I'm going to walk you through just how I did this case and kind of talk to you a little bit about the kind of results we can continue to get with this particular patient. So stay tuned. I'll wait for a few minutes for more patients to join us, more people to join us. But it's really nice because we could showcase for this particular patient. Actually comes on here every once in a while as well. He comes all the way from Minnesota. And I love being able to show patients like this who originally discovered me from these kind of talks. And was really excited. Actually, was telling me that he's going to be coming soon. And we have an amazing, excellent result for him already just after a single session. We of course did a little bit more work for him. We did do some more TCA Cross, and then we also did a little bit more Bellafill for him when he came in again. But already significant improvement after that single session right there, which is really, really nice to see. So I want to showcase that for you, everybody, just to kind of walk you through just the overall process for our scars, for our patients, and what we could expect over time if we continue to work on the skin. This is relatively early results. It's and I do think that the next time I see him, he's from Minnesota. The next time I see him, it's gonna get even better and better. But it's nice because we could see, especially with things like TCA Cross for those ice pick scars, those boxcar scars, you can see already a lot of improvement already for this patient. And then, as I said, we also worked on it with some volume for him. And he's somebody who had done a lot of treatments beforehand. He had actually done fat transfer. He did Subcision already. So he did several things. And so it was really nice that we were able to get this improvement just with this combination. Let's see here. Do patients with oily skin need to wait to get treated? Well, there's no question that we want to control your oil production. Usually the ways we do that is with maybe potentially like a low dose of Accutane or with topical creams even. Or also the Accure laser. All those could be options. But yes, you do want to control your oil production because oil could actually end up causing you to have more inflammation, and then also new acne. It also actually delays the collagen response as well. So a lot of different things are factoring in there with oil production. And if we're not really paying attention to that, we may not be able to get the best possible results for patients. So I definitely focus a lot on oil management. Thank you so much. I'm up for the question and for commenting about the results. Appreciate you. But yeah, this is one of the things that we could do which is really fun. Which is showcasing results of patients that are on these lives as well. So this is a patient that's on here. Sometimes he's comes all the way from Minnesota, so you can see this patient here. Aiden saying, I have hormonal acne, have gone off and on and off doxycycline and tretinoin, and I keep getting acne. What's next? Well, you may have to be especially if you have cystic acne, you may have to be on like an oral medication. Potentially like isotretinoin, or you could potentially use something like the Accure laser. That's another option, but you have to do something for that oil production. You got to control that really well, and so those are good options there. Jessica saying, what is the most effective treatment if you're on a budget for ice pick scarring? Easiest thing to do is really try to control your oil production, and that's going to be something with like potentially tretinoin, for example. That could potentially help you. Low dose Accutane, those could potentially help you, but it's probably not going to help enough, though, to be honest with you. And how many months apart is this? This is about 8 months apart right now for this patient. He's somebody who, when he came in again, we did do some more work for him, but this is about 8 months over here. Phenol peel thoughts. It depends on what we're trying to treat, what the skin type is. If there are thick edges of the scars, it could help with those. And then we usually want to use something where we combine it with manual dermabrasion, for example. We could do that, but it's not like the only solution. Sometimes you do have to do other treatments such as subcision. You may have to do something for volume, so it's not the only thing to potentially do. CO2 for ice pick scarring. The ice pick scars aren't necessarily going to improve enough with CO2. So you really want to do something like TCA Cross, or you may need excisions. So those are all potentially options there. But CO2 laser, unless it's really thick around the edges there, probably not going to help enough there. Gabe is saying, I'm starting to see improvement in my major scars. It's only been 4 months and a half. Awesome, Gabe. I know you've been worried about it for the progress because it's been slow. That's really, really nice to hear that you're seeing that improvement. Really, it's very different, like between a 3 to 6 month mark, 6 months to a year out, a month to a year and a half out. It's just a lot slower than people expect and people understand. It just really is. And there's no real way of rushing a lot of these things. I've had a lot of talks with a lot of patients, and they want to kind of get these really fast, magical results. Not you, Gabe, but like a lot of people will say that they just want to get really significant improvement right away. And it's just not the case, especially for a lot of these kinds of scars. It could take a lot longer, a lot slower. But I'm happy to see that's coming slowly for you. It is. Max are saying, if Bellafill, when I'm not sure what something. Okay, let's see. I guess I'll try to decipher what this Max are saying. For Bellafill, when age passes and skin sags with age, will it sag over the Bellafill, causing bumps? Well, what ends up happening sometimes is that your own skin is essentially going to sag potentially one day, and the Bellafill is just part of your skin. It looks just like your skin. My partner is a plastic surgeon. She does facelifts on our patients who've had Bellafill, and she says it looks and feels just like real skin. So that's what I would take it and just explain to you, that it is just like your real skin. So just think of it like that. What did you use for that kind of skin problem? We have the same skin problem. Well, this was with TCA Cross, this was with laser, this was with Subcision, and this was with Bellafill for this patient. So we did a few different things for this particular patient. We also, through the laser tunnel holes, put a dilute form of sculpture for this patient. And he was somebody who had done Subcision before elsewhere. He had also done laser elsewhere. He also did a fat transfer, and it just found that he wasn't getting enough of improvement with those. You know, interestingly enough, he went to somebody who does Subcision as well as fat transfer the same day, which is something I always say I'm not really a big fan of, because the problem is that you don't necessarily know the right layer that you're placing the fat in. It may not hold as nicely. It's just not going to be as artistic, I would say. And so that's something to pay attention to. If somebody's saying that they want to do the Subcision with fat transfer the same day, kind of pay attention to that. How much would this run? Most patients spend about $5,000 to $7,000 on their scars. Gabe is on. Gabe is gonna, I think, show his results. Gabe, I can't remember. Do you let us share your results? Since people are asking on other platforms if you let us share results. If you do, I can't remember if you let us share or not. Thoughts on fibroblast? Seen amazing results, but I don't know if it damages skin in the long run. I don't recommend fibroblast. I think that there's a lot more risk that's involved with it. You can get more pigmentation issues. You can get more scarring. So I wouldn't recommend fibroblast treatment at all, actually, for vast majority of treatments, actually, for conditions. I've run into so many problems with pigmentation issues, and so I see the consequences of people doing these things. They do it with estheticians and they do it elsewhere, and like the wrong skin type, and it could run into a lot of problems. As saying, using pre-treatment pigmentation cream, but it's extremely drying. Any tips? Change the formulation. Well, just mix it with a little bit of Vanity cream initially. That's all you have to do, really. Just do that, and that should end up working out pretty well. Just mix it with Vanity cream if it's really especially drying for you. Just use like a pea-sized amount. Everybody says that it is for the first couple of weeks, and it gets much better, and people start craving it, to be honest with you. But there is an element where it does get a little bit too drying initially for some patients. Thoughts on doing TCA Cross and Genesis laser in one treatment? Well, I think it's okay. I just don't really love Genesis laser for scars. I think it's gonna be pretty mild, to be honest with you. I know a lot of people push it, but like there's not many great things that I've seen with it. Can you use Accure laser for oil just for T-zone along with scar treatment same day? Yes, you could. It depends on where it's at exactly, but we could do that actually. And I've done that before actually. It's just, it depends on the locations that we want to treat, and we could do that with no problem. Thoughts on, so I actually want to go back to that person that was asking about Genesis laser. With that, it's mostly just trying to stimulate a little bit of collagen production, and that's really all it's doing. But it's really pretty mild, not going to help enough for most scars. So definitely not my go-to. I know someone's saying that they're going to do TCA Cross. TCA Cross is fine by itself, but I'm not sure what the Genesis laser is really going to help with. Maybe it'll help a little bit with some collagen improvement, but I think it's pretty mild. Is Subcision effective for thin rolling scars? Yes, it just depends on what we're trying to treat, how thick they are. Like you said, yours are thin. It may be just that we have to do a little bit of volume. So maybe we have to just do a little bit of Bellafill, for example, or Radius, Sculptra. Those could be all ideas there. And I missed a few other questions. I'll try to hit those right now. Not sure if you talked about CO2. Yeah, I did talk about CO2. For this patient, for example, he's a Fitzpatrick 5 patient. We did end up doing CO2 laser for the thick aspects of the scar. And then we did a little bit of what's called fractionated form of CO2 laser also around that area for the scarred area. And then we did erbium laser as well as the profractional erbium laser everywhere else. Thoughts on microneedling for this kind of scar? This patient actually had tried microneedling before. It didn't help him for his scars at all. He said very, very mild for his scars. So I wouldn't really recommend it. Really vast majority of times, I wouldn't recommend that. What's the difference between Qazi Clinic? So we have 2 sites. We have Dr. Qazi and then also Qazi Clinic site. Qazi Clinic is kind of like for the full team, like everything that we do. And then Dr. Qazi is more of like the things that I'm directly involved in at my practice, and really they're both like much the same, but I just have it so that the Dr. Qazi site has the prices on there. You can also just check out really easily. So that's what the whole point of that site is there. Did you do ablative CO2 laser? Yeah, for certain areas where it's like really thick, that's where we did the ablative form of CO2. Actually, what I'll do is I'll maximize this photo and you can see it. You can see it really well then. Oops, I lost it there. 1 second. Let's try to maximize this for you. Let's see if I can get it there. So hopefully you can see it better. And you can see where it's really thick around the edges there. So hopefully you can see that thickness right there. So that's where like this ablative form of CO2 will work. So when something like that, where it's really thick around the edges like that. So you can see like that, you see where it's like really rough. That's where the CO2 laser really, really shines. And I do it like local focus, I should say focused energy, just on like certain spots, not for everything. I don't do it like just high heat everywhere. That's tends to be my method for scars. Not bulk heating, especially something like this is a Fitzpatrick 5. Is it the cheekbone area? Yeah, so you can see like the cheekbone area where it's thick around there, and look at how smooth it is afterwards. That's because I went down with the CO2 laser. How soon would you work on scars after your Accutane? Well, we could do it even while on Accutane. It just depends on what dose you're on. I ideally want you on a lower dose, so I could go kind of aggressive for some of the CO2 laser. But otherwise, I actually can do it even while on Accutane. So it's not true that you have to stop Accutane completely. What helps with ice pick scars? That's with the TCA Cross. That's with Excision. Those are things that are going to help a lot with that. Are these photos after one session? Yeah, these are one session after several months. We did TCA Cross, we did a laser for this patient, and this is a patient, Hispanic male, Fitzpatrick 5, darker skin type for sure, does not burn, he only gets tan, so all of that showcases that we have to be really, really careful for his skin. What about Subcision? We did do Subcision for him. There were the areas where it's pulled down and thick. He had done Subcision in the past. He had actually done it several times, I think, and he just needed a proper, really, really nice Subcision session, and we ended up doing that. It worked out really well. Would you do another session? Yeah, we did another session when he came in for this photo. We did more TCA Cross as well as Bellafill that day for him. What kind of laser options are there for scars on brown skin other than CO2 laser? Probably the better option for brown skin, if it's relatively mild scars especially, is going to be like an erbium laser. Can you do TCA Cross with Bellafill? Yeah, absolutely we could do. Sometimes you do Bellafill same day as Subcision, other times not. How do you decide? It depends on the location of the fat loss. So I want to make sure that when we're replacing it, it's going to stay exactly there. If it's like the lower part of the face, I usually don't do any Bellafill that day. Below the bony structure, I usually don't do Bellafill that day. But in certain spots, like where it's very, very clear that I can just place a little bit of Bellafill there, I'll do it in the upper face. The temple area, I almost always do that same day. So it just depends on where it's happening, what's happening there, how thick the scars are. Sometimes though, if there's a lot of subcision that I'm doing, I may just say we have to wait to do the Bellafill because I can make sure it's exactly in the right spot. Is CO2 on Asian skin okay? Well, it could cause problems. I mean, Asian skin has prolonged redness. Sometimes that could happen. We gotta be very, very careful with that, with Asian skin, making sure aftercare afterwards is really, really good as well. So it may be issues. There may be issues with that, but it just depends on who you're going to if they're really good with it. How do you find a specialist in your area? Good question. You know, there's very, very few of us in the world, honestly. I know there's some people that could still do certain things, but it's, tough to actually do a few different things all very, very well when it comes to scars. And so talk to, do a consultation and see what the results are, see how they do, how they approach things. If they're really trying to push more towards like packages, to try and do like more like microneedling sessions or like fractional sessions, things like that. Probably consider someone else or talk to, or I could even go through like what they're saying for your kind of scars. But in general, there's very, very few of us, to be honest with you. Alex Morgan is saying, is there a limit of how much Bellafill can be used for volume loss before fat transfer becomes a more suitable option? For example, would using 25 syringes of Bellafill over 2 years be too much? No, it's not too much. Actually, you could do it. There's some people who have a lot of volume loss. Myself, I had a lot of volume loss. I didn't really have any fat to be able to use to do fat transfer, so it was actually okay to do it that way. I just went really slowly, and I didn't put it all in one area. I would just keep on putting it in different areas. But if you have fat, then yeah, absolutely, we could do fat, and it just depends on your body and your body size. Some people just don't have much fat, and we're just not going to get great fat. So it's not going to be worth it for them. That's kind of the things that we were going to look at to make sure that it's, cost effective for you to do something like fat transfer versus Bellafill. Is this patient getting another session? Yeah, absolutely. He's actually all the way over in Minnesota normally. So I don't see him too frequently, but when I see him, I'll see him, and hopefully we'll be able to set that up for him really nicely. I know I missed a few things here. Let me try to get to those ones here. Let's see. I have an appointment next week for subcision filler with CO2 on the same day. Would you recommend this? Yeah, depending on who's doing it with, it could be totally a great option for you. Hopefully it's good for you. Thoughts on skin boosters, injectables, which help to produce collagen? Well, I think that they're okay. It's probably not going to help out too much for most scars. It's like more of a temporary effect, but they're nice for patients if they just want like a quick fix me up. If you're thinking about more like Rejuveron, I think that it's better for like more anti-aging, but more for scars, questionable still if it's really going to be helpful enough for scars. What about the concern of Bellafill causing scar tissue and long-term risk since it's permanent? Well, there's risks. I think that even with any filler, really, I think a lot of HA filler ends up lasting a lot longer than they ever said. It ends up being sometimes 10 to 15 years sometimes for some of these hyaluronic acid fillers like Juvederm, for example. But Bellafill, if you do it properly, if you do it safely, which I always do, very, very clean. I want to make sure also I never put too much in one area. And you run into really no problems that way. Scar tissue wise, anything going inside your skin underneath that could cause little bits of scar tissue. That's not really that big of a deal, especially if you're placing it in the right plane. So that's really not going to be much of a problem there. Let's see here. Can you do Bellafill for jawline scars as well? What happens if scars are very tethered at the jawline? Well, we do want to do a little bit of subcision. Usually I use blunt cannula subcision for the jawline only. And then, yes, you could do Bellafill for there as well, or you may do like thicker fillers like Radies or Sculptra for that area. It depends on how much volume loss there is. But you're absolutely correct. You may end up needing subcision as well as volume for the jawline area. How effective is Resurfax? Anything that's I think that's Resurfax is CO2, right? Let me just double check here. Resurfax. Let's see here. Oh, it's not an ablative fractional laser. Okay, I was thinking of something different. Probably not going to help too much with non-ablative fractional M20, M22. Yeah, probably not going to help too much with that. May help a little bit with anti-aging, but not going to help really much. And interestingly enough, I've seen these results on this page as well, but I don't know if anybody who really is able to reproduce these kind of results with this device. I don't know anybody who really gets those kind of results with that, to be honest with you. So I'm not a big believer in just energy devices by itself, to be honest with you. I think that it's effective at a certain point for certain issues, like for the thick aspects of the scars. It can help with that, but it's not going to be really enough for the vast majority of kinds of scars. Thick scars really do require subcision if they're really pulled down. They're deep scars. You have to do TCA Cross. We have to do that. Sometimes we have to do a little bit of volume. We have to do a bunch of different things all at one time. And yes, laser is important, but it's not the only thing. So I wouldn't focus too much on just the brand names of these things. Can you do subcision for pitted pox scars along the side of the nose bridge and tip of the nose? You could do it a little bit, but it's not going to help as much as you may think. That's a really tough spot to actually improve enough. We may need to do other modalities. Sometimes actually filler actually could help a little bit better for that. Melly's saying, do you think we'll see the day where scars can be 100% reversed on anyone? Well, if they're more superficial, they can sort of be ablated and cut down, so you could do that already. But those deeper, thicker scars, let's say we take that out, we excise it, and we want into a more superficial, more narrow scar. It's possible. I'm investigating a drug potentially that could do that one day, hopefully. We're going to be investigating that this year to see if we could get that and showcase that after excision it becomes as scarless as possible. That'll be pretty cool. I'm not sure yet, though. We'll see. Some people are showing some promise with it, but is it truly scarless? Tough to say. Really, it's if it's going to get there. Right now, it's not truly scarless, but it's at some point it's possible we can get there. But the more we're learning about this, the more we're understanding about scars. I think that as we get into really understanding the skin with potentially quantum computers and something like that, to be able to get some algorithms going and really see like where the fibroblast tension could actually be reduced and things like that. Maybe we could end up getting there one day. Thoughts on PRP and PRF for under eye hollowing? It's not going to help so much for hollowing, but it will help the skin quality get a little bit better. Can you go through airport security with a mask on same day with combination scar treatments? Yes, you could, at least for our purposes in our area. Our airport knows really well. I guess it depends on the TSA agent. We give it a letter if we need to, but we've not run into zero problems whatsoever for that. Nobody's ever had a problem with that. So just something to pay attention to. That I don't see much of an issue with that. What do you do for a small keloid scar in upper body, please? Usually just a little bit of a steroid injection. That's usually all you need to do. What would you recommend for under eye hollowing then? So sometimes we have to do a little bit of volume in the mid cheek, and that could help support the under eye, the tear trough ligament. Sometimes you do need just a little bit of filler. Sometimes you need that. I know that a lot of people had a lot of questions about filler before because people were putting too much filler in them. In the under eye, but if you place it properly, if you just do little careful amounts, it look really good. Just small little bits, that's sometimes all you need to do for the under eye area. Less is more, really, in that area. I really wouldn't recommend, just doing things that potentially are going to be a waste of money, a waste of time. And if it's true volume loss, you really do need something for volume, and that means like either fat transfer or filler. And fat transfer under eye, sometimes it can look really nice, sometimes it's not the best. It just depends on like how good fat we could get, how deep the volume loss is, what level we could do, things like that. Hi, Julie. Julie's saying that she's from France. Appreciate you coming on. Thank you. I'm not sure what time it is over there, but thank you so much for coming on. Thank you for this compelling talk. How helpful is Accure for softening the acne scars in the patients you have highlighted or in general? Actually, really interesting that you mentioned that. I'm going to ask this patient. She came in today, and she's 1 year out after her Accure, and you can see her scars have already improved a lot, actually. which is really nice. And it's something you could see actually because her oil production improved, and then the diameter of the scar reduced. The thickness of the scars actually looks a lot better already. So scars improve after doing the Accure laser as well. So it's really, really nice. I'll try to see if I could get her to showcase the results, because it was, she was impressed by it as well. She was like coming in to me for scar treatments now at this point. She's 1 year after her Accure, and she wanted to do scar treatments now. And it's like, she's like, it's already a lot better. It's going to be hopefully a little bit easier. Yeah, it's going to be a little bit easier now for us, because you're got a really nice collagen response now. And then also the diameter of scars are already down. You're not getting new acne, all those type of things. That's going to help out really, really. So those are the kind of things we look at really to make sure that we can get that amazing result for patients over and over again. Just like making sure oil production is under control, acne is under control, all those things. Is there a point in time where additional treatment sessions won't yield noticeable results? I think it depends on the kind of treatments you're doing. If you're doing different types of things, then there's always something that we should be able to do to improve it, though, to be honest with you. Hannah's saying, if you do small amounts of filler forever, is it possible to never experience migration, or is migration inevitable if you do fillers for life? Good question, Han. I don't know the answer to that, because it depends on who you're going to, what kind of product they're using. But it doesn't have to migrate. There's a lot of people who do filler and it doesn't migrate. It's not true that a filler always migrates, for example. If you're placing it correctly, especially if you're going deep to the bone for certain areas, you're really not going to run into issues with migration. It's really more when people were doing this cannula approach, they're doing too superficial, and then it was bulging because people were smiling, and then it was just basically pushing that product in a more superficial pocket. That's what ended up causing it to look odd, and that's what this migration issue was occurring. But if you're placing it deep, and a lot of times for the under eye area, we place it deep to the bone as well, and it's not going to migrate there. I see patients years and years later, it still looks great, and it's just about how it's placed. So it's not that it has to migrate, really. It doesn't have to. How to treat hypertrophic scars? It depends. Sometimes you need steroid injections. Sometimes we use an ablative form of CO2 laser. And then after that, what we do recommend doing is something like silicone tape there to help it so that there's less friction over there, less inflammation. So all those things are probably the best options there. Let's see here. MD is saying, I did not have a healing cream. Is it okay if I do it without aftercare product, only hydrating cream? Just contact my office. I'll be happy to help you out there. We'll be happy to see what's going on there. If you are a patient of ours, I'm not sure, but usually we don't require too many creams. We just use just a moisturizer afterwards. Really keep it very, very simple and easy for patients afterwards. We just use just a moisturizer, sunblock. I'm not a big believer in just a bunch of creams. I do use a pigmentation cream, but beyond that, it keeps it really, really simple. So that's typically all you really need to do. All right, guys, appreciate everybody that came on tonight. Really, really do. I'll be back on tomorrow night. Hopefully, I'll be able to be on multiple platforms. There's an issue with it tonight, but I'll try to see my best if I can fix that for tomorrow. But I'm still always going to be on these particular platforms and until one of them gets banned. Hopefully, it doesn't though. Let's see. Let's see here. Where did this thing go? Jay is saying, hi, Dr. Qazi. I've seen a few cases where the patient's TCA Cross failed and the results worsened. It's tough to say. There's a lot of people that do TCA Cross. It's not necessary that it has to get worse. I do it multiple times a day. It doesn't happen to me really for patients. Months and months, years and years later, we see them and it looks significantly better every single time. There's just ways of doing it, so it doesn't have to get it. Basically, we change the concentration of the acid depending on the depth of the scars, but it also is a little bit slower, that way. It's safer, slower, so you don't run into problems. But most of my patients that with ice pick boxcar scars, you're seeing that I'm doing TCA Cross with these patients, so it's significantly improved with that. So I wouldn't really pay too much attention with people. There are some people that would say, they did laser and laser was really terrible for them and caused so much damage. But that doesn't mean that we turn down all lasers. We say that we should never do lasers or touch lasers again, things like that. It's just where the person went to, or the way that they did it, or your skin type, or sometimes even just the patient. Sometimes their aftercare just wasn't properly done. It's possible. Max was saying, I heard Bellafill causes bumps 10 years down the road. How could this be prevented? Well, a lot of hyaluronic acid filler could cause that. Bellafill depends on who's injecting it. There's a lot of people out there that inject it with a heavy hand, and I've seen them myself. I've been like shocked. Sometimes I almost like just take away the syringe when I'm years ago I used to train someone and I was training someone and I was watching and they're about to shove a bunch of Bellafill in one spot, and I was like, I just got to pull this out of your hand because this is like, we just can't let this happen right now. Even though it's a training session, this is a more permanent filler, and we just can't do this. So some people just have a heavy hand, and I'm just going to stop that right there. But there's a lot of people around there. You'll see them around. You'll walk around. You'll see as they inject and things like that, and who they went to, and try to avoid those type of people. There's people out there with really, really heavy hands, and those people, yeah, they're going to run into problems years and years down the line. There's no question about that. Should I take isotretinoin to treatment of acne scars? If you have oily skin, if you have acne, potentially you may need to. Oh yeah, absolutely, Max. Max was saying thank you for these sessions, very transparent and informative. That's the goal. Hopefully you guys get some of that there. I look forward to seeing you next month. Thank you, Vinny. Thank you so much for coming on. I appreciate all of you guys, by the way. I appreciate everybody coming on. When can you start using silicone tape? Usually about 1 week or so afterwards, 7 to 10 days afterwards. Are there any alternatives to a lower facelift? I want a sharp jawline and want to prevent sagging. Well, it depends if you really have true sagging, if there's volume loss there, if this is really pulling down, then really you just need a facelift. Otherwise, you could start doing some filler in your jawline. You could actually also do something called face tight, where we go inside and heat and contract the skin. All those could be options there. But it depends on how much volume loss there is and how much sagging there is. All right, everybody, thank you so much. Appreciate everybody.